intrinsic muscles of the hand. Now, with the rough diagrammatic representation, we are going to display that what are intrinsic. First of all, what do you mean by the term intrinsic muscles of the hand? That means the muscles which are taking up the origin as well as are getting inserted within the confines of the hand. Alright, the muscles which are taking up the origin in the proximal aspect but are getting inserted within hand are excluded. We are not talking about them. Intrinsic muscles means taking up the origin and are getting inserted within the confines of the hand. It's as such. So in total, there are 20 intrinsic muscles. 5 into 4 is equal to 20. Alright, 5 into 4 is equal to 20. Now, what is the meaning of the term 5? 5 basically is representing the group of the muscles and 4 are the number of muscles in each group. So, if we talk about the groups, the first group is thinner. As you came to know that there are 4 thinner muscles. The second group is hypothinner. So, there are 4 hypothinner muscles. Then the third group is lumbricals and there are 4 lumbricals. The fourth group is that of interossei. You know, there are 8 interossei in total. It is further divided into 4 palmar interossei and 4 dorsal interossei. Alright, so these are the interossei in total. So as you came to know, the names of the groups you are aware of, where there are 4 thinner muscles. Alright, so the groups are, there will be a thinner group, there will be a hypothinner group, there is 4 palmar interossei, 4 dorsal interossei and 4 lumbricals. So as you can see that there are 5 groups and 4 muscles in each group. Now next point is that what is the name of the muscle or what are the names of the muscles in each group. Now let's talk about the thinner first. Alright, the name of the muscles in the thinner eminence or the thinner group is flexor, pollicis brevis, opponens, pollicis brevis, then abductor, pollicis brevis and adductor, pollicis brevis. So these are the muscles in the thinner group. On the other hand, names of the muscles in the hypothinner group is flexor digiti minimi, then opponens digiti minimi, then abductor digiti minimi and palmaris brevis. So as you came to know that it is not very difficult to understand or remember the names of the hypothinner muscle if you have remembered the names of the thinner muscles. You know, the names of the thinner muscle are flexor, then opponens, then abductor and adductor. Similarly, the names of the hypothinner are flexor, then opponens, then abductor, but the last one is different, that is palmaris brevis. So these are the names of the muscles in the arranged in the thinner and the hypothinner group. Next, now you know, you just have to remember the names of the muscles in the thinner and hypothinner because lumbrical muscles are not named muscles, they are just numbered muscles. So 4 lumbricals means it could be categorized into the 2 medial lumbricals and the 2 lateral lumbricals. Alright, so you need not to remember the names because they are not named muscle, they are just numbered muscle. On the other hand, interossei are further divided into 4 palmar and 4 dorsal, so they are just numbered muscles, they are not named muscle. So 4 palmar interossei and 4 dorsal interossei. So at this point of time, it is not very difficult to understand actually what are the names of the muscles in the individual group. Alright. Now, when we complete this aspect of discussion of knowing about the individual names of the muscles and the groups in which these muscles are arranged, now is the time to have a discussion on what is the function of these intrinsic muscles. Alright. So, let's talk about the function of lumbricals. What is the function of lumbricals? It is the flexion of metacarpophalangeal joint and extension of interphalangeal joints in hand. Alright, you know these are the metacarpophalangeal joints, so they are flexed and these are interphalangeal joint, they're extended. So this is the function of the lumbricals. All right. Next, the function of interossei. We have divided the interossei into two, the palmar interossei and the dorsal interossei. So basically palmar interossei is responsible for adduction of the fingers, while dorsal interossei is responsible for abduction of the fingers. All right. When all the fingers are added together, it is adduction of the finger. When all the fingers are abducted together, means separated from each other, it is abduction of the finger. So adduction of the finger is a function of palmar interossei, abduction of the finger is a function of dorsal interossei. So this is the function of interossei. Now, once we talked about the function of the interossei, it is not difficult to recognize what is the function of the thenar muscle. You see, the name of the thenar muscle is holding up the function of the thenar muscle. Like the first one is the flexor pollicis brevis. So the flexor pollicis brevis will cause flexion of the thumb. Then opponents will cause opposition of the thumb. Abductor will cause abduction of the thumb, and the adductor will cause adduction of the thumb. So it is not very difficult to understand. Now you came to know that function of interossei is adduction of the finger, palmar interossei, abduction of all fingers, dorsal interossei. All right. Lumbrical function is flexion of the metacarpophalangeal joint and extension of the interphalangeal joint. Now what is flexion of the thumb? When the thumb is placed in front of the plane of palm, this is flexion of the thumb. So it is a function of flexor pollicis brevis muscle. When the thumb is pointing towards the opposite finger, it is opposition of the thumb. When the thumb is lying perpendicular to the plane of palm, this is abduction of the thumb. When the thumb is lying perpendicular to the plane of palm, this is extension of the thumb. And when the thumb is added by the plane of palm, by the side of the plane of palm, that is adduction of the thumb. All right. So don't get confused. Majority of you might be thinking that this is abduction of the thumb. No, it is not. It is extension of the thumb. This is abduction of the thumb. All right. When the thumb is lying perpendicular to the plane of palm, this is abduction of the thumb. So this abduction of the thumb is the function of abductor pollicis brevis. All right. As far as the muscles of the hypothenar group are concerned, those functions are not going to be converted into action. So as a result of which, they are not significantly directing the functional movement of the hand. So we are obviously not going to have a discussion on that. So hopefully everything is clear related to the function of the individual muscles in individual group. So you came to know about the names of the groups, you came to know about the names of the muscles, and at this point of time you came to know about the functions of those muscles. Now the only thing remaining is that what are the nerve supply to these muscles. All right. Now in order to understand the nerve supply, let's have a discussion on the rough diagrammatic representation of the flexor surface of the forearm. Imagine this to be a forearm and this is hand. All right. Now this forearm and hand, if this is the volar surface, if this is the ventral surface, this surface we are talking about. Now this surface is under the supply of two nerves, a median and ulnar. But if you divide this ventral surface of the forearm into two halves, this is the lateral one and this is the medial one. So if you divide the ventral surface of the forearm into two ends, the lateral end and the medial end. So you obviously know at this point of time that the lateral end of the or lateral half of the ventral surface of the forearm and hand is predominantly supplied by. So it is predominantly supplied by the median nerve. All right. While the medial surface of the forearm and hand predominantly is supplied by the ulnar nerve. So this is something which you are already aware of. All right. The thing is that, the thenar muscles, this is the thenar eminence over here, which is arranged laterally in the palm. That means majority of the muscles in the thenar eminence are meant to be supplied by the median nerve. And that is the reason why the first three muscles are supplied by median. All right. The only muscle which is not supplied by the median nerve in the thenar eminence is the adductor pollicis brevis, and this is supplied by the ulnar nerve. Then this is the hypothenar eminence, which is arranged medially in the hand. And the medial aspect of the ventral surface of the hand is predominantly under the supply of ulnar. That means majority of the muscles in the hypothenar eminence are meant to be supplied by the ulnar nerve. In reality, all four of them are supplied by ulnar nerve. All right. Now you can very clearly see that the lumbricals are categorized into two medial lumbricals, two lateral lumbricals. So functionally, two medial lumbricals are supplied by ulnar nerve, while two lateral lumbricals are supplied by the median nerve. Alright, as far as interossei are concerned, you know, all 8 interossei, all of them, like 4 dorsal, 4 palmar, all of them are supplied by the ulnar nerve. So all 8 interossei are supplied by the ulnar nerve.